Malaria Prevention in the Democratic Republic of Congo by Jessica Cole, Caleb Luchman, Melissa Tippett, and William Bickmore. What is malaria? Malaria is a serious and sometimes fatal disease that is caused by a parasite that infects a certain type of mosquito which feeds on humans. Malaria epidemic in the Democratic Republic of Congo. Malaria is a killer. Over 400 children die every day in the Democratic Republic of the Congo, and almost half of them from malaria. The Ministry of Health states that the main cause of morbidity and mortality in pregnant women and children under the age of 5 is malaria. According to the World Health Organization, in 2014, the population of DRC was 74,900,000 people, and there were 0 free cases of malaria. That means nobody was free. Everybody was positive. Poverty and its role in the malaria epidemic. As of 2013, the gross national income per capita was $680 per year. In the DRC, there's abundant stagnant water contributing to the vector, which is the mosquito.
Okay, so I'm going to give an overview of our intervention. We thought it would be helpful to introduce a comprehensive malaria prevention program. This would include multiple ways of reducing the prevalence of disease through providing insecticide-treated bed nets, information on malaria and ways to avoid mosquitoes through posters, and the introduction of specific fish into stagnant water sources that would eat the mosquito larvae. Okay, so first I'm going to talk about insecticide-treated bed nets. So these not only provide a physical barrier between the malaria-carrying mosquito and the person at risk of getting the disease, but also a chemical barrier as well. Bed nets have been shown to greatly reduce malaria morbidity and mortality, especially in children under 2 years of age. The World Health Organization has reported a 25% decrease in malaria deaths globally and a 33% reduction of malaria deaths in sub-Saharan Africa since 2000, and the introduction of the insecticide-treated bed nets. With that introduction, the decrease keeps growing. Okay, so several companies have developed long-lasting insecticide-treated nets, or LLINs. These maintain effective levels of insecticide for at least 3 years, and with the technology improving, they can often last up to 5 to 7 years, even after repeated washing. Increasing the lifespan of insecticide-treated bed nets could save an estimated of $3.8 billion over a 10-year period. After much debate, the World Health Organization now recommends that LLINs be provided for free. Donors and programs such as the Global Fund Against HIV and AIDS, Tuberculosis, and Malaria, and the President's Malaria Initiative support the purchase of LLINs for many countries, so they provide funding for a lot of new programs like ours that are starting up. We would contact these programs about a donation or even a partnership with our initiative. Okay, now I'm going to talk about malaria prevention through health dissemination. Through our research, we found that pamphlets are largely unsuccessful because they get thrown away and are loaded with a lot of confusing information. A lot of people in the Democratic Republic of the Congo are not literate or they know very little. Our plan is to put easy-to-read posters with clear pictures, similar to the one pictured to the right, in the very common areas of the village. Okay, now I'm going to talk about our last intervention, which is mosquito control using fish. So the most effective program of using fish to feed on the larvae of mosquitoes has been done by the AMCA in New Jersey. They used a versatile fish called the Gambusha affinis, which is a smaller fish that can survive in hot waters with low oxygen levels. Because they are so small, they are able to navigate between water reeds and in tight places that plants make in swamps in order to feed off the larvae. They are not picky eaters, but opportunistic. They lie low on the food chain and can be controlled through larger fish, such as bass, that feed on that fish. Along with the mosquito control using fish, we contacted a technical advisor for the American Mosquito Control Association, and we asked them just about, in general, using this fish as effective mosquito larvae control. They said that they have successfully used the fish for the control of the mosquito, and he also told us that efficacy in controlling anopheles in the Democratic Republic of the Congo by the Gambusha might encounter a few obstacles. These obstacles include that the Gambusha predators need to be accounted for, and care must be taken to ensure that introducing this fish doesn't adversely affect the local aquatic fauna that might be critical to the indigenous fishermen in the area. The Gambusha will consume the fry of other fish when available and if needed. So more research would need to be done and conducted to address these issues, but we think this would be a very successful program once addressed. Okay, so we decided to dig a little deeper and do some additional research. And through this research, we found that fishermen do use these stagnant waters as a source of fishing, but the main fish in them are tilapias and catfish. These fish are larger than the Gambia fish, but generally do not feed off of other fish. Catfish are bottom eaters, and their diet consists of seeds, aquatic plants, algae, crawfish, and snails. But if needed, they will feed on smaller fish. The tilapias are voracious weed eaters, often introduced into dams to clean up excess vegetation. So these fish would neither compete for food or be predator and prey, so it has a higher likelihood of being successful.
Alright, so now that we have actually gone over the different interventions, I wanted to go ahead and step into why we think these three different interventions, will solve the problem, this malaria issue in the Democratic Republic of Congo. We believe that through our three-pronged approach, our intervention will decrease the mosquito population drastically and give our target population a fighting chance against malaria. In this intervention, we hope to not only form a line of defense between the people of the Democratic Republic of Congo and the mosquitoes, referring to the nets, but train them on how to prevent malaria in their homes. This is referring to the pictures that they'll be seeing outside and how to, clean up the puddles and the different water sources, different places the mosquitoes could breed, as well as taking care of the problem at the very source. And this is referring to the fish hatcheries that we are intending to place, and then these fishes are supposed to be eating the larvae, and we're supposed to be seeing a drastic decrease in these mosquitoes. So through these different methods, we believe that we will see the best results. For the fish hatchery intervention, as was explained earlier, we will be utilizing the help of the AMCA, who are trained to survey the area and cater a special program for the area in which we want to introduce fish, taking into account environmental factors and impacts of the mosquito and the fish. As they come to a viable answer to the mosquito issue that this country is facing, we will introduce the fish into the environment to start reducing the mosquito population. We consider this as our first and hardest hitting attack in order to give the people of the Democratic Republic of Congo the safety they deserve, as well as a viable food source in respect to fish population control, as they are edible. So going into our next interventions, I wanted to talk about the posters that we are going to be putting up all around the Democratic Republic of Congo. We titled it the Malaria Prevention Dissemination, referring to information dissemination. We believe that through the use of these different pictures, we will be able to pass on and educate the people about malaria and how to prevent it. By suggesting different methods they can practice around their home, we give them the power to fight malaria as opposed to waiting for help from an outside source. So we really like this idea of giving them the power of them actually acting on their own, because there's only so much that volunteers and humanitarian aid workers can do. I mean, the real thing that will help this problem is to get these people to act and to move for themselves, and we feel like these pictures and educating them on how to prevent it at home is going to be one of the best ways we can do that. On top of educating the people, we want to go ahead and introduce and distribute long-lasting insecticide-treated bed nets. So coupled with the health dissemination, these nets will be the last line of defense between the people and the mosquitoes. With the population understanding where mosquitoes come from and how the disease is transmitted, this physical barrier will ultimately shut out the mosquitoes and provide a safe place to live and sleep, malaria-free. For our next section, we wanted to go ahead and talk about how we would go about implementing our intervention into a specific region of the world. And we thought we would go ahead and play the role, or play the game of trying to get it into the Democratic Republic of Congo. And we felt that we would be able to do this by employing many locals to help distribute the posters and give information about malaria. We would gather a team of environmental specialists as well to record the possible impacts on the environment that it would have. So that would be stemming from the AMCA. We would also want to join with the CDC as well. The Global Fund Against HIV/AIDS, Tuberculosis, and Malaria, and the President's Malaria Initiative support the purchase of these long-lasting insecticide-treated bed nets for many countries. And so we would go ahead and contact these different programs about a donation or even a partnership with our initiative. We know that they have done that in the past, where specifically the CDC, and the President's Malaria Initiative that exists within the Democratic Republic of Congo. We would go ahead and contact them, and they have been known to freely give these long-lasting insecticide-treated bed nets. So that was something we were very excited about and wanted to go ahead and immediately contact them so that we could have the supplies to distribute to the people there.
Our plan to overcome the low literacy level was by making posters that are picture-based and very simple to understand. The pictures would promote or look to prevent certain actions to help people understand how to prevent malaria. We found throughout our research that the Democratic Republic of Congo has a particular climate and weather pattern that would not easily allow for paper posters to survive for very long. Through the heat and humidity to the rainy seasons, paper would be destroyed fairly quickly. The solution for this problem we found would be to use rust-resistant metal posters with all-weather paint. These would last much longer than paper or even laminated posters. These may cost a little bit more initially, but will save money in the long run, as they will have to be replaced less often. Although we do not have the needed resources nor the climate to mimic a Democratic Republic of Congo-like scenario, we have taken from other sources that explain the experimentation and its success already done 2 countries over in Kenya. Although these are 2 different countries, their climates are very similar, and according to the article published by Biomed Central, malaria-carrying mosquitoes were decreased by 75 to 94%. They go on to conclude that the fish are an apparently sustainable mosquito control tool, which also offers a source of protein and income to the people in rural areas, according to a 2007 August study. We are hoping that this program will not only control the malaria-bearing mosquitoes, but also provide a valuable source of food for the people of the Democratic Republic of Congo as well. Another question that arose in our search for barriers was where to buy the Gambusian fins fish, and if it was going to be a large expense for our project. It turns out that the fish are fairly easy to obtain and can be bought from many fish stores or online aquatic wholesalers. They cost about $25 for 6 fish, which being an expense well worth it. Issues encountered with the long-lasting insecticide-treated bed nests. 1. Reported use 90% plus when actually used is 60 to 80%. 2. Possible insecticide resistance. 3. Possible postponement of human immunity. 4. Undermining private markets / sense of entitlement. 5. Allergic reaction. 6. Use of nets for fishing instead of malaria prevention. And 7. Fire hazards. Another obstacle we found was figuring out how to involve the community in the Democratic Republic of Congo. It would be most beneficial to them to have locals who speak the language and know the terrain and people, and who the people trust to have these projects. We would want to really utilize the workforce that resides in the Democratic Republic of Congo by employing locals. This would require training and hiring processes that may take time. Some other problems we might encounter might be finding the funding for our intervention program. Additionally, each of the volunteers are going to have to obtain passports, possible visas, and immunizations to be able to go to the Democratic Republic of Congo. It can take quite a bit of time to get everything together and to the point of execution.